Most people think a cough is just a minor problem. But when a cough doesn't go away, it could be a sign of a serious chest condition. A chronic cough may indicate diseases that need thoracic surgical evaluation. Lung tumors, both benign and cancerous, can present as a persistent cough, sometimes with blood in the sputum. Localized bronchiectasis causes long-term productive cough and repeated chest infections and may require lung surgery. Non-resolving lung infections or lung abscesses can also lead to chronic cough when medical treatment fails. Mediastinal masses, located between the lungs, may compress airways and cause cough, breathlessness, or voice changes. A sudden cough, especially in children, can be due to a foreign body in the airway and needs emergency bronchoscopy. Pleural diseases like empyema or chronic fluid around the lungs can also trigger persistent cough and chest pain. Narrowing of the trachea or bronchi may cause chronic cough with noisy breathing and often needs surgical correction. So, when should you think beyond medicines? If a cough lasts more than 8 weeks, if there is blood in sputum, if chest infections keep recurring, or if lung shadows do not resolve, early referral to a thoracic surgeon can save lives and preserve lung function. Don't ignore a persistent cough. Consult a thoracic surgery specialist.